Which of the following measures is considered the most effective in preventing cognitive dysfunction after cardiac surgery with CPB? A. Use of aortic filters. B. Shortening the duration of surgery. C. Preoperative cognitive testing. D. Postoperative physical and cognitive rehabilitation. Answer: D. Postoperative physical and cognitive rehabilitation. Explanation: Postoperative physical and cognitive rehabilitation is considered the most effective measure in preventing or reducing cognitive dysfunction following cardiac surgery with CPB. Early mobilization, cognitive therapy, and other rehabilitation techniques help improve brain function, reduce delirium, and prevent long-term cognitive impairment. While aortic filters and shortening surgery duration can help with certain complications, rehabilitation is the most effective for cognitive recovery. Which of the following is the primary cause of delayed neurological deficits after cardiac surgery with CPB? A. Cerebral hypoperfusion. B. Postoperative hemorrhage. C. Sepsis. D. Inflammatory response. Answer: A. Cerebral hypoperfusion. Explanation: Cerebral hypoperfusion is the primary cause of delayed neurological deficits after cardiac surgery with CPB. Inadequate blood flow to the brain during or after surgery can lead to long-term cognitive issues, such as memory problems and difficulty concentrating, which may manifest days or even weeks after the surgery. Although other factors like hemorrhage or infection can contribute, hypoperfusion is the most common cause of delayed neurological deficits. Which of the following is a potential cause of cognitive dysfunction following cardiac surgery with CPB that is most related to inflammation? A. Cerebral hypoxia. B. Microembolism from aortic manipulation. C. Systemic inflammatory response syndrome, SIRS. D. Hypercapnia. Answer: C. Systemic inflammatory response syndrome, SIRS. Explanation: Systemic inflammatory response syndrome, SIRS, is a potential cause of cognitive dysfunction following cardiac surgery with CPB. Inflammation caused by surgery, CPB, and other factors can affect the blood-brain barrier, leading to neuronal injury and cognitive deficits. While cerebral hypoxia and microembolism are significant causes of brain injury, the inflammatory response plays a critical role in the development of cognitive dysfunction after surgery. Which of the following is a common intraoperative cause of cerebral ischemia during cardiopulmonary bypass, CPB? A. Hypothermia. B. Aortic dissection. C. Insufficient blood flow during CPB. D. Use of high-dose heparin. Answer: C. Insufficient blood flow during CPB. Explanation: Insufficient blood flow during cardiopulmonary bypass, CPB, is a common cause of cerebral ischemia. If the perfusion pressure or flow is inadequate during CPB, the brain can experience decreased oxygenation and nutrient delivery, leading to ischemic injury. Hypothermia is typically protective, and high-dose heparin helps prevent clot formation rather than causing ischemia. Which of the following perioperative interventions is most beneficial for reducing the risk of postoperative cognitive dysfunction, POCD, after cardiac surgery with CPB? A. Maintaining normal blood glucose levels. B. Routine administration of neuroprotective agents. C. Avoiding prolonged use of sedatives. D. Increased intraoperative blood pressure. Answer: C. Avoiding prolonged use of sedatives. Explanation: Avoiding prolonged use of sedatives is crucial for reducing the risk of postoperative cognitive dysfunction, POCD. Prolonged sedation can impair cognitive function and lead to delirium or longer-lasting cognitive issues. Maintaining normal blood glucose levels and controlling blood pressure are also important but are secondary to minimizing the effects of sedation. Which of the following biomarkers is commonly elevated in the blood following cerebral injury during cardiac surgery with CPB? A. B-type natriuretic peptide, BNP. B. Brain-derived neurotrophic factor, BDNF. C. S100B protein. D. Creatine kinase MB, CKMB. Answer: C. S100B protein. Explanation: S100B protein is a biomarker commonly elevated in the blood following cerebral injury during cardiac surgery with CPB. It is released by astrocytes in the brain and is used as a marker of neuronal damage or ischemia. BNP is associated with heart failure, BDNF with neurogenesis, and CKMB with myocardial injury, but S100B is most directly related to cerebral injury. Which of the following is a significant risk factor for the development of postoperative delirium following cardiac surgery with CPB? A. High body mass index, BMI. B. Preoperative renal dysfunction. C. Younger age. D. History of psychiatric illness. Answer: D. History of psychiatric illness. Explanation: a history of psychiatric illness is a significant risk factor for postoperative delirium following cardiac surgery. Patients with a history of mental health issues may be more vulnerable to the effects of anesthesia, sedation, and postoperative medications. Other risk factors include advanced age, but psychiatric illness is particularly relevant in the context of delirium after surgery. Which of the following strategies has been shown to reduce the incidence of stroke in patients undergoing cardiac surgery with CPB? A. Low-dose aspirin administration preoperatively. B. Use of an aortic filter. C. Maintenance of low hematocrit levels. D. Increased systemic blood pressure during surgery. Answer: B. Use of an aortic filter. Explanation: the use of an aortic filter is the most effective strategy for reducing the incidence of stroke during cardiac surgery with CPB. The filter traps embolic particles that may otherwise travel to the brain, reducing the risk of stroke. While low-dose aspirin and blood pressure management may have other benefits, they are not as directly effective in preventing stroke as the use of aortic filters. Which of the following interventions is most likely to minimize the risk of cerebral injury in patients undergoing aortic arch surgery with CPB? A. Maintaining mild hypothermia. B. Use of high-dose steroids. C. Routine carotid artery stenting. D. High-flow CPB with aortic cross-clamping. Answer: A. Maintaining mild hypothermia. Explanation: maintaining mild hypothermia during cardiac surgery with CPB has been shown to minimize the risk of cerebral injury, especially in patients undergoing aortic arch surgery. Hypothermia helps to reduce cerebral metabolic demands and provides neuroprotection during periods of reduced blood flow. High-dose steroids and carotid stenting are not standard practices for cerebral protection in this context. Which of the following is the most common neurological complication following coronary artery bypass grafting, CABG, surgery with CPB? A. Stroke. B. Delirium. C. Seizures. D. Subdural hematoma. Answer: B. Delirium. Explanation: delirium is the most common neurological complication following coronary artery bypass grafting, CABG, surgery with CPB. It is typically seen in the early postoperative period and is often related to factors such as anesthesia, sedation, and the inflammatory response to surgery. Stroke and seizures are less common, and subdural hematoma is an uncommon complication.